We've heard a lot about the impact of the coronavirus on nursing homes. Now we're learning the virus is hitting patients and staff at psychiatric facilities all across the U.S. There have been 34 confirmed cases at Western State Hospital in Washington. It's one of the largest psychiatric hospitals west of the Mississippi. CBS News senior investigative correspondent Catherine Herridge spoke to staff there. Catherine, good morning. What are you learning?
Well, Tony, good morning. The state's epidemiologist called the outbreak at Western State, quote, serious, but also gave the hospital credit for taking early action that may limit infections. The hospital is one of nearly 2,000 inpatient psychiatric facilities across the U.S., and caring for these patients presents unique challenges during a pandemic.
We are a hospital, too. We are not a medical hospital, but these are patients. And just because they have a mental condition, and some of them are violent, they're still human beings.
Social worker Maria Claudio works at Western State Hospital. Just outside Tacoma, Washington, it is the state's largest psychiatric hospital with over 800 beds. According to the union, about 25% are elderly patients.
Are there any special measures being taken to protect these patients on the high-risk wards?
No.
Nothing.
Nothing.
CBS News spoke to more than a half dozen Western State employees who worry the hospital isn't taking COVID-19 seriously. They say administrators are floating staff between wards, potentially spreading the virus, and have abandoned temperature screening workers.
Are you concerned that the hospital may be a safe space for the virus to spread?
Oh, it's a haven. I do believe that there's going to be a lot of deaths.
Staff told us social distancing isn't a viable option because many patients require hands-on care.
We are fighting a war. We are not given any tools to protect anybody, let alone ourselves. So it's like we're doing a suicide mission.
Fearing retaliation for speaking out, this hospital worker asked us to shield her identity.
I think we have it worse than a traditional hospital because our patients can at any given time become violent. You know, we have patients that don't understand the grasp of coughing into your arm or sneezing into your arm.
I am wearing my Seahawks cloth mask.
And nurse Sharon Bether told CBS News the hospital only recently provided some protective equipment after weeks of forbidding staff from bringing their own, according to internal hospital emails.
At that time, nobody was allowed to wear masks. If they see you wearing masks, they will tell you to take it off.
Here's a closet with clothes.
Maria Claudio's family bought this used RV, anticipating she will need to self-isolate in the weeks ahead. Like her co-workers, Claudio says she is committed to the patients who are among society's most isolated.
They rely on us for everything. They are locked in there. We have the keys. We have all the power. So we have the responsibility to take care of them.
Spokesperson for Western State told CBS News that they moved quickly to protect their high-risk population, limiting infections, and now even more aggressive actions are being taken. CBS went back to the hospital staff we interviewed, who said the changes don't come close to addressing their ongoing concerns. Tony?
Well, if the allegations are true, we do hope those changes are made and swiftly. Catherine, thank you very much.